Good afternoon, and welcome to Preventive Medicine Grand Rounds for January 13th, 2021. My name is Antonio Neri from the CDC Division of Scientific Education and Professional Development. The Preventive Medicine Grand Rounds is sponsored by the CDC, Preventive Medicine Residency and Fellowship, as well as the Bureau of Health Workforce at the Health Resources and Services Administration. The PMRF provides 12 and 24-month full-time longitudinal service learning opportunities for physicians, veterinarians, and nurses who have applied epidemiology experience. We use Adobe Connect for the audio and presentation, but use the chat box to pose questions. Note you can pose questions via the chat box at any point during the lecture, and the speakers will work on answering them at their discretion. Closed captioning is available using the webinar link in the box on the bottom or the side of your screen. Continuing education credits are available for the live course up to 1 month after the presentation date, and for the recorded version, up to 2 years from the date of the presentation through the CDC Training and Continuing Education online portal. The course code to access these grand rounds is all capital letters CDC PMRF. If you have any questions, please contact myself or email the program at prevmed@cdc.gov. Please remember that the views presented by the speaker are theirs alone and do not represent CDC, the Department of Health and Human Services, or the U.S. government. Today's grand rounds will be entitled Environmental Health for Preventive Medicine, presented by myself, Antonio Neri. The presentation will be approximately 1 hour with 30 minutes for questions and answers afterwards. Before we start, I had some announcements. First, I wanted to highlight that the application for the Population Health Training in Place program, which is administered by the CDC PMRF, is open through the end of February. This year, we are excited to welcome applications from learners whose terminal degree is a Master in Public Health, along with learners who are physicians, veterinarians, nurses, allied health professionals, and doctoral level science who also have a Master's in Public Health. The PHTIP 12-month training program is aimed to improve the leadership and management skills of mid-career professionals who are in or aim for leadership positions. We will focus on both population health and data modernizations for the 2021 class. You can find more information on the website that we will post in the question box during the lecture. Secondly, as a program with nearly 5 decades of experience in placing residents and fellows to work with and learn from leaders in our federal, state, and local government, we were honestly shaken and disgusted by the riot that took place in our nation's capital last week. Myself and many of our more than 400 alumni have spent countless hours working in those very halls, as well as those of state and local governments. We also know that while there is often drama in political theater, the majority of people working in those positions uphold a high moral code of conduct and go to great lengths to ensure a more perfect union through civil discussion and debate. In light of our upcoming celebration of Dr. Martin Luther King's birthday, I found it most important to highlight 2 of his most powerful quotes related to nonviolence, a position this program has long held. The first quote, "True peace is not merely the absence of tension, it is the presence of justice." I have every expectation that those responsible for developing and perpetuating blatant falsehoods that have undermined the health and welfare of the entirety of this great country will be held accountable for their actions in doing so. The second quote, "We adopt the means of nonviolence because our end is a community at peace with itself. We will try to persuade with our words, but if our words fail, we will try to persuade with our acts." I personally wish to offer my condolences for the lives lost that day, but it is clear that a lack of planning and communication placed the lives of both police and rioters at mortal danger. I wanted to appreciate how few injuries and deaths there truly were because of the restraint and heroism showed by the well-armed police when pushed to retreat by a truly murderous crowd. Events could have turned out far worse than they did. I believe this, in some form and fashion, was adherent to the principles of nonviolence demonstrated by Dr. King, Gandhi, and many other great leaders during times of unrest. These acts of violence, incited by lies and perpetuated by hate, are, in my eyes, blatant displays of insecurity and weakness. I believe it is critical that we as a nation must not let the cowardice of the few determine the actions of the powerful many. It is up to you in this very audience, in this very day, and for any time in the future, to steel your reserve, straighten your back, and to use your words and nonviolent actions to bring about change so we can restore the country to what it could be, not what it has been lately. My last announcement. I wish to dedicate a moment of silence in this lecture to all the healthcare providers and public health staff who have lost their lives during this pandemic. In particular, I want to dedicate this lecture to a friend working in environmental health that we lost prematurely in 2020, Christopher Kachitsky. Chris was a good friend and hardworking colleague at CDC's National Center for Environmental Health, a center we will talk about in our following discussion. He and many others epitomize the nature of environmental health work that we will highlight today. He truly demonstrated the spirit of environmental health, a kind of tireless dedication that comes from long days and nights spent working in relative obscurity to prevent diseases before they ever happen. When Dr. Frieden, the former director of this agency, was leaving his post, he made a comment something to the nature of, "Do you remember when MERS or SARS swept through the United States? Or Ebola killed thousands of Americans? No, you don't. And that's because of public health." Well, it was Chris and countless others out there who are working to stop this pandemic and prevent future ones who embody this dedication, and to whom we owe eternal gratitude. With that, let's start with a moment of silence for the fallen and begin our discussion. Okay, let's start talking about some environmental health issues. So number one, with environmental health, I want to really strongly emphasize in this lecture, some of which my residents have heard from before, some of which they haven't. That environmental health is so encompassing and really is in the entirety of the places you live, work, and breathe. Live, work, and play, I'm sorry. And all of these public health achievements in the past number of years have related to environmental health most in some form or fashion. Not only does that include some of these top ones like motor vehicle safety, safer places to work, but infectious disease control from the places where people live and go into clinics that are either full of people who are infected and they want to remain not infected or transmit their disease, as well as those people going into such locations as grocery stores and those other activities that involve the lack of disease transmission that sometimes you would see if there weren't for environmental health actions. So all of these tie into environmental health in some form or fashion. I think their environmental health has played a critical role in decreasing infant, neonatal, and post-neonatal fatality rates, as indicated in this graph in the US, with a sharp decline in the 40s and 70s down to the 2005 period, and an increasing decrease of the gap between infant, neonatal, and postnatal mortality has all been contributed to by environmental health. Similarly, the life expectancy at birth by Black or white race and sex between 1970 and 2011 has increased. But I'd still like to highlight, and I think that there is some component of environmental health related to this increase. But still, this large gap you see between races and genders remains a persistent problem for public health, and environmental health plays a role in that. And we'll talk about that in a moment. What I want you to understand in the fundamental aspect of environmental health practice is that there's an interrelated environmental systems. And there's places in which you do things on a day-to-day basis that you don't know how much effort goes into those activities until something goes wrong with them. And those encompass all 6 of these activities. And so it might be the water, or the places where the sewage goes after you flush it down the sink, or the other activities, gray or groundwater, the air you breathe, where your trash goes. Things like that you don't notice until it actually doesn't function, or functions poorly. I want to go back a little bit as a a student of history and trying to understand a little bit more about how not to repeat the activities of the past. And just for, I know I can't see you in person. Normally I would ask you a lot of questions as I do my residents, but if you were to ask, what are these two pictures of? Give you a second to think about them. If it's better if you know the artist behind the photo on the left, the picture on the left. All right, so this is Monet. The painting was painted in 1904, and it's in London. It's the fog in London, and there's the Houses of Parliament coming through. One of the greatest painters of our time, and really a person inspired by what ended up to be environmental pollution. If you look on the right side, there's the London fog, which was sourced from Industrial Revolution in that era. And so the London fog is not just a Coke brand that you see nowadays, although it is something that you see on a routine basis, not only in London back in the 1950s, but on the left, you can see it in Los Angeles in 1958. This is a street in Los Angeles. And if you were to put this same picture, you could have probably seen this in Beijing, China recently too. The person on the right is Rachel Carson, a relatively obscure author up until that point. In 1962, she published a book called Silent Spring. And this was what many people call a clarion call towards environmental health. And it wasn't really honestly well noticed until a couple of years later, as most authors are. And that became clear as the time went on, especially in the near 5 or 10 years after that. A culmination of problems led in the 70s up into increased action on environmental health, and I wanted to highlight that. For all of you history folks out here, I'd ask you to label this picture. I want to note that there's a boat, and it's riding through fire. That's an indicator that the river's on fire, which doesn't seem very common. And of course, if you guessed it right, this is the Cuyahoga River. This is a picture taken in 1969. It was due to industrial discharge that was in the water and on the surface of the water that caught fire. This is the 12th time that river caught fire. That the river caught fire in 1969 from environmental discharge, from waste discharge. That is incredible. And one would hope that would not occur to this day, ever since. I'm not aware of rivers catching fire, even in industrializing countries. But I'll tell you, having worked overseas and worked in places that are less environmentally conscious than the U.S., there are places where it is entirely possible they could. I want to talk a little bit about one of the seminal events in environmental health that came about in the 70s. And it all started at this place called Love Canal in Niagara, New York. If you are familiar with geography, you'll notice that Niagara Falls here is in the center left of the picture. And then Niagara itself splits two countries, Canada on the left-hand side of that blue line and the United States on the right. If you're a person who remembers the lakes of Great Lakes, Lake Ontario is up to the north and Lake Erie is to the south, you can see on the bottom right, it's not as well indicated as one would wish, but right below the Niagara Falls International Airport, there's a red box. And that is actually a canal that was intended to be dug as a transit point between those two Great Lakes before, because certainly you can't transit your equipment and goods between off of Niagara Falls. It wouldn't work. But it was an inspirational endeavor by an industrialist back in the probably late 40s and early 50s to create a canal that connected those two lakes, Lake Erie, Lake Ontario. In 1954, in that same area, they erected a school. They built a school, and it is called the New York 99th Street School. And this is a picture of it, both a more modern picture and a more antique picture. I think I have a picture of it on the left. One more. So you can actually see it here in 1970. The school is in the middle of the canal. If you wrap your head back to the picture we had before, the geography, you can see that Lake Erie is down below us. And Love Canal is right in the middle. And you can see they've since filled it in a lot. But you can see the school in the center left of the picture in 1970. Approximately in the mid-70s, there was a passionate person who was actually, I believe, a secretary at the school, who noticed that there were a large number of miscarriages and crib deaths in her community, and who started a group called Love Canal Homeowners Association. In what was probably one of the earlier environmental health studies, she and her colleagues went through and identified that a majority, 18 of 22 pregnancies in that region, had resulted in miscarriage, stillbirth, or birth defects. This is a map of those areas on the bottom. You can see that Love Canal is spread out in a longitudinal way instead of a north-south way, as we had seen in those pictures. But the school is actually approximately at the center of those, and you can see a small river that runs through. Each of those black dot represents a miscarriage in those homes. This is the second map of the study, and this is all birth defects. So the first one was miscarriages. So this is miscarriages. This is birth defects. And you can see that there's a pretty strong correlation between those, pretty strong geographic relationship to those. And hopefully, one of the things that you'll look up further in this endeavor is if you haven't got involved with it as a state or local health department into cancer clusters, this is probably one of the original studies of cancer clusters that were truly clusters. But this is not a cancer cluster, but it's a cluster of disease and illness. But it's something that time immemorial in environmental health has occurred. And it's up to you as a state or local health department or a preventive medicine practitioner to determine whether this occurred by chance alone, or there was an actual statistical aberration, or it was truly a relationship between some sort of exposure and some sort of disease, whether that be cancer, birth defects, stillbirth, or miscarriage. Act 4, most importantly, is looking at urinary systems, kidney and urinary systems, and it showed a 300-fold difference in urinary tract disorders in comparison to what I believe is a regional comparison. And I think, especially in cancer clusters, more for your information down the line, is really to find an appropriate comparison population. And although this is a very limited geographical study, what would be most appropriate is to try to further expand out your population for comparison to see if there's something even at a broader regional level that this is maybe a norm for the region or maybe not. And you'll note that there's a 300-fold change in urinary tract disorders, again, located in that same similar pattern. Sorry for the blurry picture, but this is what we have. Again, note on the top right, this is 1979 and 1980. That school had been erected back in what era? 1952, 1954. So this study occurred a number of years after that school had been in operation and that community had been in operation. What happened is if you were to look further back in history, you'll see that there was a company called the Hooker Chemical Company. It was situated in the exact same valley in 1950. This is a chemical company that produced dyes, perfumes, and solvents. You can see a picture of it here on the photo. And well, Love Canal in 1970 looked like a pretty pristine community. If you took a picture, notice the pictures are inverted. So the picture on the right is likely taken from the water looking towards the camera versus the picture on the left is from the land looking south, and the picture on the right is land north. These are all the chemical waste barrels from the Hooker Chemical Company back in 1950. They've since in 19 must have been around in the early mid-50s that they had covered those up and made a more relatively flat surface that you see back in 1970. But they had covered them over. And that was one of the sentinel events that occurred in the 70s, of all of which we'll talk about led to this culmination of a larger environmental health effort. So that series of things from the London fog, depicted by the pictures and as well as Monet's paintings a lot earlier, the fogs you saw in Los Angeles, the Cuyahoga River fire in the late 60s, and in the 70s, Love Canal, showing a large number of miscarriages, birth defects, and urinary problems in an area that had chemical contamination, led to the creation eventually of the Environmental Protection Agency, which we'll talk about here in a second. One of the common questions that you'll get in preventive medicine, I think is fundamental for you to understand, is who is responsible for environmental health? And I think what the most important thing you remember in large regard to this is there's a number of agencies involved. And most often it comes down to where the fence is in a jurisdiction. You can see that the United States Environmental Protection Agency, which was created in 1970, had a series of acts, congressional acts, that are called by their abbreviations: RCRA, Resource Conservation and Recovery Act, and CERCLA. I'm not going to read off all the titles, you can read them. So in 1976 and 1980, and these were two Superfund-related activities that required, by their congressional acts, that required EPA to look at currently operating facilities, industrial facilities, to see whether they were going to be damaging the land and set aside funding to recover the land that they were, depending on the amount of chemical and the type of chemical they would have and the damage they were inflicting on that area. In 1980, the legislation was focused on abandoned or unknown ownership, and both of those collectively led into the Superfund. So the Superfund was both a creation of RCRA and CERCLA, but it was created under the auspices of the Environmental Protection Agency to help not only prevent and further contamination of existing industrial areas, but to address it in those cases where they were abandoned or unknown responsible parties. From the Superfund came a couple of things. CDC was created in the early 50s, but later on, the Agency for Toxic Substances and Disease Registry was created under funding from the Superfund. It's a separate federal agency from CDC, although the CDC director is both the director of CDC as well as ATSDR, and usually that is deferred over to the National Center for Environmental Health director. But ATSDR is, you think about it, ATSDR is the human side of exposure. So looking at the stillbirths and miscarriages would be an ATSDR position, whereas the chemical contamination would be on the Superfund side of it. So EPA generally focuses on the chemicals and the environment, whereas ATSDR focuses on the human beings involved. Where this gets more complicated is there's a number of players that are involved in environmental health at the federal level. Two of the main players are the National Center for Environmental Health, that centers at CDC, and the National Institutes of Environmental Health Sciences under the National Institutes of Health. And if one were to make it convenient, we would put these two into separate categories. One from the NCEH really focus on applied public health, and then the NIH side, NIEHS, focuses on the venture laboratory sciences, somewhat similar to how EPA focuses on the chemical or environmental side, ATSDR focuses on the human health side. Although there's considerable overlap between those entities, and often you'll see them working together in situations to identify and address, prevent environmental contamination and exposure. What is most important is understanding the jurisdiction for environmental health agencies, and that occurs at the federal, state, and local level. You can see where it happens is depending upon where the fence was, and that fence being this designated zone where the contamination occurred. The problem being is that human health doesn't stop at a fence, and contamination doesn't necessarily stop at a fence. And so what often occurs is you'll often have many, many jurisdictions involved in trying to determine who has responsibility for that environmental contamination. And really it is the fence. So with terms of Superfund, you'll see ATSDR and EPA get involved about people who are located inside that fence or who were exposed inside that fence. ATSDR's job is a little bit more difficult because people move outside that fence sometimes. And especially once a strong fence like this on the right is erected, then that's more clear cut between who is inside and who's outside. But ATSDR's job is much more difficult because people move across geographic boundaries, political boundaries, if you will. Where you also get involved is the CDC, National Center for Environmental Health, which does environmental health investigations. If it's an occupational exposure, the National Institutes of Occupational Safety and Health will become involved in an investigation, as will their state and local components of environmental health at those agencies. So what you can see is it's very complex in how an environmental health issue is identified and addressed, but it often comes back down to jurisdiction, as it does in a lot of different political situations. This is nowhere better demonstrated than the Navajo Nation. So this is the Navajo Nation. You can see it's centered across 3 states, New Mexico, Arizona, and Utah. You can see in the colors are the chapters, which are, I guess, there's not, the equivalent would be a county in a state. But then you can see that the state boundaries cross the Navajo Nation, which encompasses a large part of the black area with the different colors, is encompassed in those areas. And then those chapters differentiate between different counties in those states. And so you have a lot of overlapping jurisdictions. The red dots, as you might have noticed, are abandoned uranium mines on the Navajo Nation, and also on the Hopi Reservation, which is contained within the Navajo Nation. Of course, the Navajo Nation, being an independently recognized entity from the United States government, has its own form and structure of government that interacts with all these different players. And these abandoned uranium mines, which are there because there is a rich source of uranium. And you'll also note that New Mexico was part of the nuclear triangle, if you will, as well as sites in Arizona were related to weapons testing, nuclear weapons testing, like Los Alamos. And that's where because in part uranium was produced in these areas, and particularly on the Navajo Nation, a number of mines. But you can see, hopefully, by this picture, that there's a lot of different entities involved in whose responsibility is it, and where do those people go. The other thing that's very, very difficult in environmental health is trying to correlate a person's disease with an exposure, unless it's really egregious. So what can happen is you can be exposed to an abandoned uranium mine, but it's also related to the dose, duration, and intensity of exposure. And so if you get, it's similar to say, if you were to walk by a uranium mine, is that sufficient to cause you damage in a radiologic way or a heavy metal way? Probably not. But if you were to walk by aerosolized mercury plant, for some reason there was aerosolized mercury, then that would, right? So it depends upon the dose and duration of exposure, as well as the type of substance. We'll talk a little bit more about that in environmental health as we go down our lecture. So what I hope this encompasses is a brief history, and I do apologize for the rapidity in which we're moving through things. The environmental health encompasses the places where you live, work, and play. So, and it's really only places that don't work whenever they're not functional. And so we'll talk a little bit more about those. Some of the environmental health issues that I wanted to highlight are seen here, and one of the folks who used to work at the National Center for Environmental Health told me is that a lot of things in environmental health run back to the 3 R's, and then there's a whole host of other activities, but rats, radon, restaurants, and roaches, which is 4. But you can see all of those pictured here. If you'll notice, the rat in the middle is on a ship line, and that's anchored to a ship that is going up and down. The rat's able to access a ship, which means it's carrying whatever diseases rats have and then transporting them back to the land. You can see a sewage outfall. So if you ever lived in Chicago, if you lived in Chicago in the 1900s, you would not be able to swim in the Chicago River because it was a natural sewage outlet for the entire city. And then similarly, if you perchance go to swim in the Atlanta Chattahoochee River, there, and after a day of unseasonably heavy rains, what you could run into is environmental contamination on the Chattahoochee River, because a lot of the solid waste or the wastewater, the sewage processing facilities are by the Chattahoochee River, and so. But by federal, state, and local regulations, they're very strictly monitored, and there's often notification that you'll see, as you see on the far left, of no swimming, diving, or any kind of, particularly during storms. Roaches themselves are something that we deal with a lot in the South, and a source of consternation if you're a homeowner or a restaurant goer. But you can see in the middle, if you had looked carefully, that is a sewage cover, and that's when sewage backs up. If you ever get excited, as sometimes I do, to look into how sewage works in waste stations and lift stations, you'll notice that sewage doesn't always flow downhill, and you have to have electrical pumps which move sewage along. When those pumps fail, perchance during a power outage, then those pumps fail, and they sometimes fail dramatically. And if sewage backs up in a place like this, where there's raw sewage coming out of a manhole cover, and that's because of possibly a failure of that sewage system. Mosquitoes remain a problem and part of the ecosystem nonetheless, and so environmental health deal with those. And then food inspection spores. So it's not that you've ever had, hopefully you've been into, maybe not recently, but in restaurants, and the inspections that prevent all those diseases that occur that are germane and important. Let's talk a little bit about that. Let's talk a little bit about the controls we are going to enact from an environmental health standpoint. And really, this encompasses any sort of intervention in public health. And it really comes from the most effective to the least effective. The most effective at the top being elimination, and then the least effective being personal protective equipment on the bottom, which is opposite of what you would call the public health pyramid, which really looks at policy interventions all the way up to individual interventions on the top. But I would like to highlight that this hierarchy of controls can be applied not only in environmental health, but in a number of other public health situations. And they're generally very evidence-based as you stay up to the top, and then less evidence-based as you go down. I want to talk about a couple topics in depth related to environmental health that I think are germane to highlight during our time together. One of them is food safety. So food safety is a critical component of environmental health. 1 in 6 of you will get foodborne illness each year. And 3,000 people die. You can see the number of the number of foodborne illness on multi-state outbreaks. These are not the outbreaks that occur in just a state or local health department. These are states across the country have increased over time. And I do not have information for 2015 onward. You can see there's been a steady rise in the number of outbreaks. And that is likely a little bit of a reporting bias in the number of census systems we have to determine what is an outbreak. But it is also likely indicative of a more and more interconnected food system where there's contamination that could be passed through a larger and larger geographical area. I point this out. This is a number of the type of illness. If there's a single source of foodborne illness, what it's caused, it's hard to see, but you can see on the bottom, on the top left, that fish is the predominant cause of foodborne illness in the United States between 2009 and 2016, followed by dairy and a number of other meats. There is not often a lot of vegetables or things that are cooked, as you can see on the top left side of that graph. But the meats are particularly problematic, as is dairy. And so what I hope you look up in terms of, if you're a physician studying for the boards, is knowing that there's proper holding times and temperatures as cooking temperatures for fish, and they're separate. They're different for chicken, beef, and fish. So what I hope you do look at is why that is, and really how food is stored. Even in your personal life, what I would encourage you to do is take a food handler course. We'll talk about that a little bit. I see a couple of our folks are on here from the National Center for Environmental Health, and I'll look to them to highlight their work here in a second. Or I won't look to them because it's a one-way interaction, but I want to acknowledge their work. This is a Georgia Department of Public Health restaurant inspection scores, and there's a couple things I want to highlight on this from an environmental health perspective. Number one, these are often undertaken by the Department of Public Health, and the environmental health section is a predominant means of doing so. So if you look at the top left arrow, you can see there's a risk type, and it looks at the type of restaurant what's the risk for the public. So low risk to high risk, and it's important that different entities classify those in different ways. But it's important to know that there are ways in which to classify those. On the bottom left arrow, what I ask you to focus on is there's different categories to look at for foodborne illness, and so those are related to, although you can't see them quite well, is related to the supervision. the type of food they're handling, whether they actually have approved sources of food, whether they're tracking the cooking of that, all those components. On the far right, you can see that there's a number of points assigned to it, and those cumulatively result in a current score, which is at the top right, and a current grade, which is associated with that score. Here's just another example of what those activities are, and you can see the different areas that are highlighted. What I encourage you to do, which I normally have in in-person lectures, is to go back and look at the restaurant inspection scores for your area. They're posted right here. You can see in this link in DeKalb Health, environmental health and food safety. For DeKalb County, actually, you can look at them. And I encourage you to look at them. It usually consumes a large portion of one's time once you get into looking at your favorite restaurants, although COVID has decreased retail use. Why do we go through restaurant inspections? What's the utility they're in? And I saw a couple of the authors of this study are actually online with us right now. I'd like to point out two things. Number one, Vincent Radke, who's the fourth author on here, is really one of my heroes in environmental health and the past president of the National Environmental Health Association. But really, a number of folks on the call, on the presentation, as well as those who have since retired, have undertaken what I think is one of the sentinel studies in identifying why are there differences between restaurants that have outbreaks and what are the differences between those that have outbreaks and those that don't. I highlighted in a red box, the restaurant has a certified kitchen manager. And this is one of the sentinel findings of a program called SNET that Carol Selman used to help run from the CDC side. I believe she's since retired. But if you look at that, that is one of the predominant factors and the only significant factor that's protective in this odds ratio of table 2. And so you can see there's a very distinct difference between the outbreak column, which is the left column, and the non-outbreak column of 7 restaurants versus 243, and a very significant protective odds ratio for having a certified kitchen manager. What does that mean? And this is actually really a highlight of Environmental Health's National Center for Environmental Health's role in it, is that led to a program called the National Restaurant, that eventually resulted in the National Restaurant Association ServSafe certification. What is this? This is a training course that one must take, and different state and local health departments take on different requirements as to what restaurants need to do or not. In Georgia, you're required to have a person who's gone through this certification in your restaurant and that works in your restaurant. Usually, this is the kitchen manager or the one of the main chefs involved in there, and that is the result of this study before. So you can see that having a certified kitchen manager, which is this program specifically, has decreased the number of outbreaks, and that finding has remained true over time since the 2003 was the source of that study. And what NCEH's role is at CDC is to try to promulgate that this is an evidence-based intervention to decrease the number of foodborne outbreaks at locations. One of the more interesting parts of the National Center for Environmental Health and the connection between the infectious disease world of CDC and the environmental health world is a recent publication that looked at the number of people who Googled or any sort of anti-diarrheal or foodborne illness type symptom, and in a de-identified way look at the time that they spent at a certain location, particularly those at restaurants in the past 7 days, and was able to identify restaurants that had very low inspection scores or poor inspection scores were associated with a significant difference in the number of people who Googled for diarrheal illness symptoms, signs and symptoms, or treatment. And so in a more modern way, that's a little bit of that technology headed in direction that works to try to protect the public. Let's talk a little bit. No environmental health lecture would be sufficient without discussion about lead poisoning prevention. It is one of the bread and butters, although not an R, in environmental health. To first start off, I wanted to get a little bit geeky about chemistry. And so if you're familiar with it, what I usually try to do is cut off the title, but in the sake of time, I've added it here. This is hemoglobin. So this is the oxygen-carrying component of blood. What I'd like you to notice is in the middle is an iron molecule, and And of course, iron is a positive charged substance, it's a cationic substance, and it is critical to the function of hemoglobin. Why does that matter for lead poisoning? Let's talk about that a little bit more in a second, but then think about all the functions in cells that are based upon sodium ion exchange or cellular ion exchanges that are basically looking at the differences between potassium, sodium, and calcium and the charges between those two in cells. And so your body functions on electric differences and based upon charges on those particles, sodium, potassium, and calcium, as well as a host of other substances. But it's this difference in charges. And I want to highlight that because lead is a cationic substance. It's a positive charged substance that will often involve interfering with these mechanisms as well as hemoglobin. Lastly, I'd like to highlight that calcium plays a critical component in bone. And your body is 99% of your body's calcium is stored in the bones. And not only is it stored in the bones, but there's a continuing ongoing use of calcium, particularly during pregnancy. And so there's this mobilization during pregnancy in women of calcium and the subsequent utilization of that by the fetus and then the child. What happens, particularly as you're growing up, is your body accumulates calcium. And what the problem is in terms of lead is if you put a person in a high concentration lead environment or even a moderate concentration lead environment, women particularly will store that lead in their bones, as will men. But men rarely turn it over, but women do. And that is a big, big problem for lead poisoning prevention, and we'll talk about why that is in just a moment. But I wanted to highlight that there's a positive charge and a cationic substance here related to the body's calcium. To talk about lead poisoning, you have to discuss really your human body into three different compartments, which is basically a solid, a liquid, which is your blood, things that you eat or ingest or swallow or breathe in, eventually work their way into the blood, which eventually works its way into the soft tissue and eventually works its way into bone. I compare that to three different substances. There's a glass of water on the bottom, the sponge, and then the brick on the right. If you put high concentrations of substances in one component, particularly in the blood, because that's the primary entryway for any substance into your body, unless there's gunshot wound, a different type of lead poisoning. But if you have high concentrations of any substance in your blood, it eventually transmits into the soft tissues, which eventually at high concentrations tries to balance out with that in the hard tissues, the bone. And you can see that here on the bottom side with this with the leaching of calcium out of this brick substance. But I want you to highlight that the body works in similar ways. If you put high concentrations of lead in the blood, it eventually works its way into soft tissue and eventually works its way into bone. And a lot of things in environmental health, particularly with heavy metal contamination, work in that manner. The longer you're exposed, the more the tissue substances from blood to soft tissue to bone become and increase their amount of concentration of that substance in them. That's critical. Because that means also the time you take a person out of that environment is really critical to remove them as soon as possible. This is particularly damaging for children. And you can see that this child is fingering something that is looking like flaking paint, and that sure enough is lead-based paint. And so if you think about this child who is probably between less than the age of 5 and I'd say between the ages of 2 to 3, they're going to put substances in their mouth. And so children are particularly at risk for lead poisoning and particularly at that risk from lead-based paint. And because they're so close to the ground, between being on the ground with all two hands and all 2 feet and putting substances in their mouth on a routine basis, it is particularly susceptible to obtaining and swallowing lead-based paint, as well as picking it up from the floor. So children not only are at high risk for exposure, but high risk for disease and outcomes from it. I want to highlight too in lead poisoning that dust lead remains one of the most predominant sources of lead poisoning. There's been a lot of discussion in the past in recent times about water and lead, and that remains a component. But lead from lead-based paint remains the predominant source of lead poisoning in the United States. So I wanted to highlight The problem with lead and health effects is that there's no one symptom that belies a person's exposure to lead that is very telling. You can see on the right side of the graph is the adults, and the left side is on children. Children have a much less tolerance for lead poisoning than adults do because of their growing bodies and the amount of growth and movement in their cells. You can see on the bottom left side, even at lead levels of 10 micrograms per deciliter, and I note that the current action level for blood lead levels is 5 micrograms per deciliter. All you're seeing in children is a small change in IQ, and that can't be measured until a long time out. You're looking at changes in nerve conduction velocity at 20 micrograms per deciliter. And you really don't get any frank symptoms of lead-based lead poisoning until you get into 50 micrograms per deciliter in children. And really children that perish or die over 100 micrograms per deciliter, which is incredible, incredible dose. Adults have less of a problem with lead because they have more mature systems to deal with it, although they still have issues. And again, what I wanted to highlight with lead poisoning is the U.S. has gone through a number of situations of industrialization where they have dealt with lead-based paint, lead and gas, and those things. And there's no reason, absolutely no reason, that other countries need to go back through that same learning process as the U.S. has for addressing lead. A little bit of cellular chemistry, if you will, for why lead causes problems. And so lead poisoning interferes with the delta aminolevulinic acid, which really results in a formation of a malformation of hemoglobin. And so what you'll find is in the past you've had situations or assays that look at the concentration of lead in your blood using some of these other precursors, and certainly protoporphyria is one of the substances in the past that people looked at in the past and identified lead poisoning. And so you'll see for concentrations at that bottom part of getting protophore. I'm not going to try to say that. Protoporphyrinogen 9 and the lack of its conversion into heme B because of this change of lead substituting for iron. It's one of the old markers for lead poisoning in the United States. But it's because of this cationic substance, this plus substance that is a substitute and interfering with the enzymes that create hemoglobin. Blood lead levels have decreased in the United States since 1976 to 2006. You can see these are National Health and Nutrition Examination Survey blood lead levels, which are actually lead levels were venous, taken from participants in the NHANES study during these time periods. The problem with the success of blood lead prevention, pediatric lead poisoning prevention programs in the United States is that there's still a large degree of lead poisoning that occurs. And although this graph has moved far and far to the left, you can see the right side of the graph is the NHANES studies from the 1970s, and on the far left side of the graph, which is lower blood lead levels, or averages in the United States. On the left side, those are 2011 2016. But the problem being is that there's still a large component of women of childbearing age who are exposed to lead in the United States, and particularly in their younger years. So what happens is we created this cycle in environmental health. So it's not that the children themselves are exposed to lead-based paint, but because their mothers are, and they're turning over lead during that time period of infant development, that their children are exposed to lead-based paint. And so it is a vicious cycle. And until you decrease the amount of lead in the environment and eliminate it, there's really it's very, very difficult. It's not easily feasible to decrease the amount of lead in a person's body, particularly when it's been in any sustained long-term way, when it's been there for a long time, particularly when it's incorporated in the bones. So lead-based paint is still a predominant source, and lead poisoning in the United States is still a predominant issue, particularly amongst women of childbearing. If we remember back to the hierarchy of controls that we talked about earlier, you can see that the lead poisoning prevention interventions are largely based upon policy interventions that decrease using that elimination component of the hierarchy of interventions, starting from the Lead Poisoning Prevention Act. Lead Poisoning Prevention Act back in 1970s, which is the initiation of the Environmental Protection Agency as a result of those things we talked about earlier. And decreasing the amount of lead and gas, lead-based paint in homes still remains a problem, although it's decreasing as the number of homes that have lead-based paint are destroyed over time. But particularly where you run into lead-based paint problems is still low-income housing in the United States. But then particularly with gentrified housing, so people that will go in and renovate homes that were traditionally old homes without the knowledge that there's lead-based paint in them, and sand down the walls and expose their children to those lead dust becomes problematic. Let's talk a little bit about radon before we go through a typical day. Radon is atomic number 86. It actually is a decay product of uranium, which is a natural product in the Earth. You can see on the bottom left, you can see that radon, which goes through a series of changes as a uranium or an atomic decay product, a radioactive decay product, enters homes. And it particularly enters homes through a variety of pathways, mostly from the floor. And the reason it enters homes is because homes have a negative pressure in general. So homes in the summer have high heat on top of the roof, which creates a vacuum and pulls a lot of air inside them. Particularly in the winter, when they're enclosed, the houses are warmer than the surrounding land, and so they create an entry point for radon. What happens with radon is that homes don't allow the natural air turnover that you would see of radon escaping those areas. So once you've contained that radon in areas, it will not allow it to go out, and subsequently that radon goes and irradiates the lungs, eventually leading radon being the leading cause of lung cancer among non-smokers and the second leading cause among smokers, with a concomitant or additive effect for smoking. Smoking, of course, being the most egregious cause of lung cancer in the United States, but radon is a particular one. I do have a great video, which I usually show, but in the sake of time, I'm not going to bring it up. But I encourage you to, if you do get a chance to look at some radon in homes, there's a great video using a cloud chamber here that you can look at, and you can look at the differences between Georgia and Navajo Reservation on radon concentrations. And of course, Navajo Reservation being a source of uranium mining, hence a source of radon. But the different characteristics of the homes on Navajo Nation versus Georgia allow for different concentrations of radon based upon the tightness of the home and the conditions that surrounds it. So I encourage you to look at those links. One of the things I wanted to highlight in the hierarchy of controls, and really particularly in public health interventions of policy analysis intervention, looking at where you can partner with other activities across public health. And having worked in the CDC Cancer Division, I worked a bit on radon exposure in how to introduce that into cancer plans. Cancer control programs, last I heard, there's about 50 or 64 cancer control programs in the United States, all 50 states, 7 tribes, and 7 territories. So that might have changed in the recent past. But looking at those cancer coalitions, which identify and address specific cancer activities per state based upon stakeholders from public, private, and academic sectors, is a way in which coalitions can go to identify and address things through a variety of stakeholders. And so this is just an analysis we did of radon and cancer plans over the time. And so you can see that some states added it, some states decreased it, but this is tied into those critical roles of public health assessment assurance, and policy development. And a unique way in which you can partner across typically somewhat siloed activities to intervene and develop some pretty strong and robust interventions for environmental health as well as cancer reduction. I want to briefly discuss a little bit about what an environmental professional does on a day-to-day basis. And really it ties into the core functions of public health of assessment, assurance, and policy development. These are recently revised, but they're largely the same. I'd say the biggest change is a much welcome focus on equity here in the center. And so what I would like you to think about is not only where your public health and careers will go in terms of these, but moving beyond these, and moving beyond this idea of just understanding a disease to addressing it. And that's, I think, the heart of preventive medicine is the treatment arm, if you will, of public health. Diagnostic arm is really important, which is more of the epidemiology side, which is critical. But I think the treatment arm of preventive medicine is one of the more important parts. You can see from our past discussion that there's a lot of things that go on in environmental health at the federal, state, and local levels. But really, state, local, tribal, and territorial levels are where environmental health is the rubber meets the road, if one would say. And so this is a whole host of activities that occur that you probably aren't even aware of unless you're an environmental health practitioner. So I wanted to highlight a couple of these roles. And again, I want you to think about things that are not typically understood or you would think about in a situation as being something that prevented you from becoming sick. So this is an average week of an environmental health practitioner. So looking at drinking water. So if you ever go back to, you get excited about looking at drinking water, you probably don't notice it till it isn't available. And so when you go in, part of the routine testing is this idea of a BACT or bacterial testing in community water systems. And this is a water tank that is sometimes readily contaminated by other sources and sometimes not routinely maintained. If you wanted an entertaining afternoon, you can go look up water systems of New York City, and sometimes you'll see rooftop systems that are quite open to the elements that collect drinking water through a series of pumps and just leave it open to different sources of contamination, which eventually lead to a whole host of problems. I wanted you to notice on the left-hand side that there's a boil water notice, and particularly during times where there's a rupture in a pipe, in a drinking water pipe, and there's a loss of pressure in a system because of a system outage. What happens is boil water notice will often occur because both water and sewer pipes by nature run pretty close to each other, and that's just the nature of having a distribution and collection system in a convenient location. But the beauty of drinking water is reliant upon the pressure where they're in within the system. There is no 100% sealing of drinking water. But once you've created a negative pressure in that drinking water system, it being next to a similarly leaky sewer system, it has a potential to pull that sewer water into the drinking water. And so that is why there becomes boil water notices during times of power outages or loss of water pressure, because you are no longer able to guarantee that positive pressure in which to drive the water, drive the sewage, keep the sewage from coming. Vector control. So understanding whether West Nile virus cases are coming in, you'll see mosquito traps at times, and those are all environmental health roles. If you ever wonder why West Nile virus doesn't sweep through the United States or dengue doesn't sweep through Puerto Rico, as it sometimes can, it's because of environmental health and balancing out those issues of what's going to damage the insect population versus is that harmful to the general population that's exposed. And if you're an environmental health practitioner, you get involved in fogging operations for mosquito control, you'll certainly get a lot of inquiries and angst about fogging activities and understanding what you're putting into environments and how you're trying to balance out this idea of vector control for West Nile virus or other mosquito-borne illnesses versus contamination of what would be perceived contamination of an environment is a routine part of environmental health specialist job. Institutional inspections. So when you have children, if you have children, you would assume that they just go to schools that are somehow that are regulated, and this is an environmental health person's job. And so there's a whole host of not only daycare inspections, but making sure that children are not exposed to things like lead-based paint, chocable substances, all the way down to how the ball pits in those places are cleaned, and particularly what the disease control situations are if children get sick. You have probably not thought as much about that as you have during COVID, particularly if you put your children back into daycares during this pandemic, and really about the disease control that occurs in those areas or does not occur in those areas. Food service inspection is a sort of bread and butter, if you will, no pun intended, of environmental health, and it relies upon not only understanding the clean environments, but that inspection activity, but whether people are trained and adequately doing food service preparation as well as serving times and temperatures. Sewage complaints end up taking up a large part of environmental health specialists' time and energy. And so particularly with open septic systems in more rural settings where domestic animals are attracted, and then not only the attraction of domestic animals, but the connection between, or potential connection between these sewer sources and a drinking water source. So particularly during times of drought where you have two separate systems, a sewer system and a drinking water system, as the water table goes down, it tends to pull in the water or the sewage water that would normally be more diluted and cleaned as it went into the water table. It tends to pull that sewage water in, and it creates a cycle. You actually have sewage contamination of drinking water sources, which is really difficult to address. And similarly, if you also got excited about, I would encourage you to look at septic tanks and how they work, how they are maintained, and particularly in relation to solid and liquid waste, because I think there's actually it's a very elegant system in the way in which sewage systems work and drainage and leach fields work that you often don't think about until they fail. If your sewer system fails, you certainly know about it. But if you maintain it, you don't have to worry as much about that. On Friday, you would get a mold complaint. And one of the questions I would ask you before we round out our presentation is, what do you think is the best indicator of the presence of mold? Really, the best indicator is not the companies that will sell you these expensive tests, nor the something you buy at Home Depot to say, do you have mold? Because there's probably mold everywhere in the world. But it's really the smell or sight of mold. And so if you go into a place that has a musty smell or moldy smell, that's the best indicator of presence of mold. So I bring that up as a caution to folks who would rely upon so-called professionals for mold testing, as it can be a bit of a shady practice in which to come into any situation, all of which will likely grow mold, and come and say, well, you need mold remediation. That's not entirely true. So what I encourage you to do is to talk with environmental health professionals. If you have concerns or your friends have concerns about mold, deal with it all the time. They have a very strong approach to doing so. It's evidence-based. So to talk about that. But that's an environmental health specialist job, talking about things like mold, like you see here. And finally, I'd like to round out our presentation. This is my last slide with CDC's National Environmental Health National Center for Environmental Health, the Health Tracking Program. The Health Tracking Program is a program that takes a lot of different data sources from CDC and puts them next to health indicators in communities. Again, it's not appropriate nor it's not appropriate probably to compare those two. Just because you have cancer as in a community doesn't mean you were exposed in that community unless you have a very fixed population who lived there for a long time, like you had back in Love Canal, the diseases that you saw. But it's increasingly rare for people to stay in one location and develop disease in that location. So what the Environmental Health Tracking Program does is it talks about environmental contamination and disease and really helps to identify whether there's a correlation between those two. But it's a very, very difficult to draw that relationship. But nonetheless, it's a common inquiry. And so the Environmental Health Tracking Program works hard to try to provide as much information as Okay, with that, I think we're at the end of our presentation. Oh, I wanted to also highlight one last thing. With the National Environmental Health Association, there's a specialty called the Registered Environmental Health Specialist or Registered Sanitarian. And this is an accredited program that CDC helps contribute towards building the capacity of environmental health. I wanted to note that environmental health capacity is lagging even farther behind in public health capacity. And there's a lot of people who are aging out of it, and there's not a great deal of of capacity building in the United States for environmental health. And I think that that is in part what's going to hurt the public health issues that we see today, or be amplified by the lack of capacity to identify and address environmental health issues. So I wanted to highlight this program as an accredited approach towards developing environmental health capacity. And it's not well known. So if you do have interest in that, please do look into the National Environmental Health Association and work into developing this capacity within your communities. That's the end of our presentation. I will take questions. You can post them in the question and answer box. And we only have to the top of the hour, but I'd love to hear your questions. All right, I'm going to start reading off some questions. I'm going to move to the bigger form, unless Lily wants. Can you move us to the Q&A part? Let me go from the top to the bottom. So one of the questions is, do Superfund sites typically coordinate across state lines so that land on both sides of the state border are cleaned up at the same time? That's really a great question. And I think at a federal level, the job of federal level is to coordinate across state boundaries, particularly multi-state outbreaks, as you saw, but Superfund does the same thing. Where I think you run into problems with cross-state things is the state health departments themselves coordinating and local health departments coordinating, and everyone coming to a harmonized approach. Certainly, there are Superfund sites that are more harmonized in addressing those than others, and as well as the politics which agree to those. So the other thing you run into is the jurisdiction, not only the jurisdiction, whose jurisdiction, but where you place the fence. And so some state health departments and Superfund might disagree about where a fence is placed and how you do so. So it is a complex situation, and there's a lot. Really, it's incredibly difficult to over communicate in those scenarios, and really, it's a lot of people working together to identify and address situations and their differences therein that works best. There's a question in relation to climate change. So, environmental health agencies in the context of climate change. I'm going to try to bring us to this bigger view so I can actually see. So climate change is an activity. So number one, climate change is science-based. There's evidence-based for climate change. You certainly had one of the hottest years on record in the United States since 2015. Climate change has changed everything you do, from the way in which people move to the locations of cities. And certainly CDC has been involved in climate change in the past and remains involved in one fashion or another. And climate change isn't just people getting hotter. It isn't just having more air conditioning run. It's the physical relocation of cities. It's the concurrence of hurricanes on a more routine basis. It is the amount of water that's left in an aquifer for cities to drink or not drink and not have that. And so there's a lot of coordination between federal, state, and local health departments on climate change. And CDC, for a while, had a climate change program. I haven't honestly looked at the status of it lately, but there is certainly a lot of work in that area, and I believe there will be an increasing amount of work soon, particularly in recognition that climate change is certainly a science-based, evidence-based occurrence, and there's increasing ways to do it. One of the things that's most interesting about climate change, particularly in the times of current era, is the impact of everything to telehealth or telework, and decreasing greenhouse gas emissions from a large and significant decrease in commuting. There still is a great deal of commuting and pollution of areas, but that being said, the amount of traffic and the pollution occurring is significantly less during the pandemic, both out of nature and nurture, as one would say. So if there were a silver lining towards telework and towards the pandemic, which there likely is an egregious thing to occur, it's that there's a decreased amount of emissions of greenhouse gases and increasing recognition of maybe what's working in a very, very unfortunate natural experiment or unnatural experiment that had actors involved. um, so there was a question about preventive medicine physicians and balancing science and activism. So government versus private companies, and I appreciate that question. I think personally that there's a need, number one, of good people in government. There's a need for good people in all sectors, public, private, and academic sectors. I'm biased, but particularly in government, there's a need for people who care, people who want to do the right thing, who have a strong moral code, who follow ethical principles, and I think there's a moral obligation for you, especially if you disagree, right? And that's maybe in a way in which the United States is really neat in its own way, because you can disagree with the system but work to try to change it instead of being thrown in jail or otherwise disappear. So I would say that I would encourage you, if you disagree with somebody, number one, talk to them. Don't throw things at them on social media or hide behind a computer or other things, but also work with those entities. And so the recognition, I think one of the bigger failings of the movement towards a less connected society, as far as telework and mobile phones, is this ability to talk to somebody and really to understand and listen. So listen to government, listen to private companies listening to government agencies, and learning. The longer I'm in public health overall, the more impressed I am with the ability of committees to provide sound advice and thorough consideration, particularly in safe environments, for debate and negotiation, or to move things forward. So I think the federal government has a strong role for people who are interested in being involved in this program. Preventive Medicine Residency and Fellowship remains a strong advocate for encouraging people to have open and honest discussions, as well as change the world. And I don't take that burden of a program lightly, nor do I let my residents or fellows take it lightly. Neither should any of you. So there's a question about radon exposure in addition to workplace exposure. One of the radon is an interesting component and an interesting environmental issue. In the early 2000s, radon became a very prominent issue, and the Environmental Protection Agency decided to take it up as a very strong cause. And some had felt that radon, when they did so in the early 2000s, it was without a great deal of evidence basis behind it. And what happened was the evidence came later, after EPA took it on, but subsequent there was a lot of pushback from people who felt that radon interventions were unjustified, not evidence-based, that radon's an issue. And so there's a lot of evidence that caught up that ended up coming back to radon over time. And particularly in that time period, and even back towards the 70s, there was a recognition of building practices and how that affects air turnover in homes, and as well as increasingly airtight buildings have a problem with radon because they don't circulate. They recirculate the same air, and particularly radon exposed air continues to recirculate. So a majority of the studies are based upon residential radon because the predominant source of a person's time is spent in the residence, and anywhere between 12 to 16 or 20 hours is spent in a home. And so most of the focus and most of the studies have shown a clear relationship between radon concentrations and radon exposure over the dose and duration, as well as relationship to lung cancers, particularly lung cancers are particularly deadly and very, very low survival rates. There's not been as much work in residential workplace exposures because of it's been very difficult to quantify the degree of exposure in those locations because there's such a variety of people that work in them over time. Homes have been much easier, and particularly when there was a much lower turnover rate in home ownership, it was much easier to identify. Radon was such a significant factor, particularly when high concentrations in homes that people lived through for a long time. While I'm talking, I'm going to go back and present this slide. I really like this activity here. But present this video and as I talk about radon. So a lot of the studies, there's been a series of studies in Europe, China, and the United States that show that radon is related to, high radon concentrations are related to lung cancer. And so what hasn't been shown is whether you run back into a very fundamental issue of cancer development, which is one-hit hypothesis or multi-hit hypothesis. So is cancer because one cell goes bad and just promulgates rapidly, or is it because one cell keeps getting damaged and the DNA keeps getting damaged and repaired over time? What I'm going to do here is share my screen so you can. Oops, sorry. I'm going to share my screen here for a second. And as we talk, I'm going to mute this because the sound doesn't come through anyway. I'm going to narrate it. But radon is a largely a domestic thing. I'm going to pause it right here. What you see are gamma rays, which are radioactivity coming from just the sun. So these small narrow trails you can see right here are normal radioactivity coming from the sun. You can see bigger tracks that are related to radon. And so these are the bigger tracks you see coming in here. I don't know if hopefully you can see it, but see that there's one right here. This is a cloud chamber. I'm going to show a picture of it in a second. This is a normal amount of radon in a home, in a cloud chamber. A cloud chamber is basically creating a difference between a very cold substance with which is dry ice on the bottom, you'll see in a second, versus a warm environment, and it creates a vapor because of that difference in air temperatures and concentration. You can see here that he's developing a cloud chamber by putting dry ice on the bottom of this board. And this is in a home that has radon in it at a concentration of approximately 100 picocuries per liter of air, which is 25 times greater than the EPA action limit of 4 picocuries per liter of air. And this is all these large particles are radon concentrations in homes. I love this video as a demonstration of what radon is. You can see some smaller particles which are related to their sun's rays, but these are all particles. Couldn't get away with an environmental health lecture without. I'm going to stop sharing my screen for a second. Here. I'm going to stop sharing. I'm going to go back to sharing your PowerPoint. Okay, let me get back. The national, someone asked whether the National Toxicology Program is a part of ATSDR or NIH. I'm not familiar. I can look at that and try to look it up. I'm not sure whether the next National Toxicology Program is part of one of those two places. I can get back to you, though. Can you talk about some of the challenges involved in developing policies for environmental health, and where there's much resistance from industry? So yeah, so environmental health is really, I think, fascinating, and policy development is a particular passion of mine. What we've often done in any policy, doesn't matter whether it's environmental health, infectious disease, or other components, is to try to find policies that are working. Evidence-based policy is really, honestly, not as well studied as one would wish, and not as well promulgated as one would wish. But what I've often found to be successful is to find policies in any activity, environmental health or otherwise, that are working in similar political environments. So particularly, if you talk about red states and blue states, what one red state will typically red states, the politicians in typically conservative states won't accept the policies in states that aren't known to them, and that's probably even a better comparison. So say you're in a state where you have different political leanings, you're less prone to accept that that activity will occur or is successful in your state if it occurs in a state that you are in opposition to politically or otherwise. Yet, if you find a similar state that has a political leaning that is in favor of the elected folks, that has a policy that getting those folks to talk often results in a much better relationship between what is an evidence implementing or adoption of evidence-based policies. One of the more interesting studies I ever did was to look at radon policies in 4 states amongst home buyers and real estate agents. And so there were 2 different policy types. One was looking at this policy that had been shown to be really effective of increasing radon testing and mitigation in one state because there was a notification during a home sale. You had to sign a piece of paper as to whether there was radon testing done in the home or not. Given in a signature process, you have to sign a lot of paperwork, but the states that showed that tripled the number of homes that were tested for and identified and fixed for radon versus those states that didn't. So I went back and did a qualitative and quantitative mixed method study, looking at realtors and home buyers. And it was really the adoption of policies in similar political environments worked best in that situation for states that had found that policy in which to require radon notification of home sales to be similar in that state that they related to, whether that's a geographic or political relationship. But similarly, the states that didn't have those policies had both the realtors and the home buyers were pretty aligned on not wanting to do it. And so I think you're somewhat prone to following. You have to work to convince people, and there's a lot of discussion that can occur in a policy development environment and arena. But hopefully you can work with like the National Council of State Legislatures or other environmental health and other policy-related folks to find similar policies. The other thing that I think is important, particularly in relation to between public and private sectors, is to identify that that there are a lot of altruistic folks in business, and if you understand that the bottom line, the dollar, is paramount in business, and I think that rings true in healthcare too. There's a lot of altruistic people, but they still have to have a bottom dollar. Being able to, in any negotiation, to understand the other side's viewpoint is critical, is absolutely critical. And so there's a lot of businesses that have taken on big causes that have resulted downstream in both an improvement in health. And one of the things I'd like to highlight is Georgia. Georgia, which has typically been a more conservative-leaning state, has adopted what they call the Georgia Broadband Development Initiative 4 years ago. And that has been intended to improve the access of business and communities towards broadband internet. What we're looking at and what public health has not been involved in, but what I'm keenly interested in is this idea that this has actually facilitated the conversion and improved the health of those communities. But it's business run on improving the broadband in those communities. But the immediate impact is access to health, to telehealth. And so there's been a great pairing of those two. And trying to find those commonalities, I think, is not only important, especially in this day and age, but probably even more so important in this day and age. But I think that there's a lot to be learned from those relationships between those. I'm going to do one more question, and then we'll probably take off. Let me read this before so one of the questions was about getting buy-in from local jurisdictions about doing evidence-based interventions, and I think I addressed parts of that. It's been really tough, and I think the other lesson that I've learned over my time in public health in the last 15 years is that is it, you can have a lot of credibility, you can come in with a lot of credentials, but I think having connections and being in relationship with the people who are affected and impacted by those things is the most critical component. And as I was watching the House and the Electoral College after the riots, one of the senators from Nebraska, I believe, came back and was talking about how critical it was to have a relationship with the people that live right next to you. And so, and it doesn't matter whether you have a conservative or liberal approach to it, having that relationship is critical. So you can throw as many activists as you want into Appalachia to look at mountaintop removal, to get out of mountaintop removal mining. But until you actually live there, until you actually are part of that population, you just aren't going to have the credibility that you would want. And so having really working incredibly hard to foster and develop those relationships, I think is important in that credibility. And that's probably more a broader application of my overall credo in life, is trying to create positive relationships and more of them over time. Let me see. The last one is policy and environmental health. Policy is critical. So I think one of the essential aspects of public health practice that's not practiced much in preventive medicine residencies especially is this idea of a policy analysis. Often we get tied into looking at complex epidemiologic studies that are related to, whether you've controlled for 100 different factors that come back to saying that this is more related to a complex factor that we've controlled for all these areas. But really, cancer policy analyses are often very simple. They don't involve a great deal of complex statistics, and you can often run them. They can if you want to. But there's a CDC policy analytic framework that our program uses that I've really enjoyed over time. And there's nothing magic about it. There's nothing magic about pulling together a group of stakeholders, taking an objective view and talking about what other states are doing and looking at the impact they're in. And that's where some of these simple things, this cancer plan activities, you could do it with, this activity right here, was done with a undergraduate student who I had partnered with when I was at the cancer division. Very little experience with complex stats, and neither is there a need. It really is, the story tells itself. So I think policy analyses, and certainly the CDC policy analytic framework, is important. With that, I'm going to let you go, because we do have our check-in at the end of this. Please do join us next. We will go back to the first Wednesday of the month. I again appreciate your time and efforts, and I do encourage you, really, really, really stay strong. I do think we, as a nation, will get through this. Do not give in to the cowardice of others. Do give in to the majority of practice nonviolent approaches, and we'll get through it. I think we'll be okay. All right, take care. Stay strong, everyone, and I'll see you next go around.